March, you know it. We've been concentrating it all month long. It is raising awareness about colon cancer. It's one of the leading cases of cancer deaths here. But with proper screening, it's also highly preventable. The 5-year survival rate is higher than 90% when cancerous tumors are found early. And joining us now to put colon cancer prevention, screening, and treatment in focus is the great Dr. Robert Donegan, medical oncologist and hematologist over at GBMC. Nice to see you. We talked when the governor was diagnosed with cancer.
We sure did.
And here we are, Colon Cancer Awareness Month. Once you get to 50, get in for your colonoscopy.
Absolutely. Screening saves lives. We've seen an improvement in screening over the last 20 years, but it's not good enough. Too many people are not being screened. We need to do a better job.
Why are we so afraid of this?
I think there's a stigma. I mean,
Okay.
it's not something that people are going to talk about at a cocktail party, so they're not going to encourage each other. I think there's a fear of the actual testing, which is not as bad as people imagine it to be. And I think there's just a fear of cancer. People want to put their head in the sand for a lot of reasons around cancer.
It used to be really scary, but now we've seen, hey, we can beat colon cancer.
Absolutely. As you said, when detected early, greater than 90% are cured of their disease. So, and early detection is really what counts. If you wait too late and it's advanced, then the 5-year survival actually less than 10%. So, you got to get it early.
Would you like to see it earlier? Like go to 40 years old instead of 50? You got to get in there?
Well, so there are screening guidelines that are out there, and they are based upon good science. And right now, the standard screening should begin at 50 years old, so for somebody who's considered average risk. If somebody has a higher risk for colon cancer, then screening may want to begin earlier, sometimes as early as the age of 40, if not younger for those at very high risk.
And every 4 years get tested, right?
No, not necessarily. It depends upon what sort of screening is done. So the colonoscopy, which a lot of people fear, although it's not that bad, 5 or 10 years. For
5
some.
or 10 years?
Yeah, for those that are average risk.
All right, for those of us sitting on the sideline not wanting to go, what are the symptoms here, doctor, that we may have it?
So they vary between people. So sometimes it can be abdominal pain, it can be blood in the stool, although most blood in the stool is not colon cancer, but it can be. Unexplained anemia, low red blood cell counts, which can cause fatigue and tiredness. Unexplained changes in the bowels, a thin stool that's much thinner than usual, for example. But it's important to note that early stage colon cancer is usually asymptomatic, and that's why it's so important not to wait until the suspicious symptoms occur to go get checked out, but to have your screening done well before that.
Real quick, one more quick. Can I, when you left medical school till today, I mean, we've made great advances in battling colon cancer, have we not?
Sure we have, absolutely.
So that's the positive.
Yes, better prevention, better earlier detection, and better treatment. So the mortality, the risk of dying from colon cancer is much better now than it was 25 years ago when I graduated medical school, but it's still not good enough. 50,000 people still die from colon cancer every year in the United States. A sold-out Camden Yards game. That's how many people die every year in this country. It's just too many.
Thanks for bringing awareness. Dr. Donegan, guess where he's going to be tomorrow? Oh, man, he's an Irishman.
Happy St.
Born in
Patrick's
Cork,
Day.
right?
Born in Cork, you got it.
Very good,
Yeah.
Irishman.
Yes, I'll be out on the thoroughfare driving down to have a good time, absolutely.
Okay.
All right.
All right, let's have a good time with weather right now. Here's Mike Taylor.
Hey, so far